Hello everyone, I hope this finds you well. I'm Delvin. Today I want us to go through infection control. That would be our content for this week in the dental department. Now, the main areas we're going to look at include the introduction, infectious cycle, objectives of infection control, and operatory asepsis. Now, basically, we would look at the terms infection control, sterilization, sterile disinfection, disinfectant, and asepsis. When we look at the fact infection control, this is the act of minimizing or removing the microorganisms that may, however, cause infection in either party, the doctor, the nurse, anybody handling the patient himself, and may actually increase the cost and stay of a patient in the hospital because of the infections that may occur due to the open wound that usually present in the dental unit. Now, another term is sterilization. Sterilization is actually getting rid of all microorganisms from the surface, and this helps to minimize chances of infection of the patient or the healthcare team working with the patient. When we say an object or an instrument is sterile, it means it is free from any microorganisms, even the spore-forming microorganisms. When we talk about disinfection, it is about reducing or minimizing the number of microorganisms on a surface, on an object, or on a person. Basically, it does not remove all the microorganisms, but it reduces the number. And it does not really kill the spore-forming microorganisms. So it helps to reduce the chances of infection in the dental unit. Asepsis is basically about employing techniques that maintains or minimizes infection or reduces the microorganisms during the procedures that may be carried out within the dental unit. Now, when we talk about our next topic is our next heading is infectious cycle. When we talk about the infectious cycle, it's more of a chain of infection. For an infection to take place, we have the infectious agent. An infectious agent is the agent that causes the infection. Now, at this point where we have an infectious agent, when we come in with either sterilization or disinfection, we have a higher likelihood of killing this infectious agent and stopping it from causing infection. So in the dental unit, surfaces may have infectious agent, the patient, the doctor. So by the time we cause a barrier to the infectious agent from causing an infection, then we are protecting either the healthcare team or the patients from infection. Now, one way is to put on protective barriers. Another way is sterilization. Now, we have a reservoir. A reservoir is what houses an object or an animal or a surface that houses the infectious agent. Another way of controlling infection at this point is by destroying the reservoir, or if it is the instruments, by sterilizing. When it is sterilized, the infectious agent will be killed and it will not cause infection. Now, for an infectious agent to get into a person, there must be a susceptible host. A person may become susceptible, especially in the dental unit. A person may become susceptible if there's breakage in the continuity of the skin or the mucous membrane. In this case, if we have tooth extractions or manipulations, that leaves an open wound and makes that person a susceptible host. Another way a person can become susceptible is when the person has reduced immunity for one reason or another. It might be a disease, it might be a drug they're taking that may have lowered their immunity. So such makes a person susceptible to the infection that is caused by the infectious agent. Now, for the microorganism or the infectious agent to be transmitted from one person to the other, there is need for a port of exit, the way through which the infectious agent moves from one person to another. Now, a port of exit may be through skin that is shed off. A port of exit may be through the droplet, the nose or the mouth, that is the respiratory system. Another port of exit may be the fecal oral route and such. So that has to happen for the infectious agent to move from one person to another. There has to be a port of exit. But even though there is a port of exit, there must be a means of transmission. How is the infectious agent carried from one person to another? One way is through sneezing, through the droplets. Another way is through touch. Another way is airborne. Another way is ingestion, fecal oral route. So when we use hygiene in the areas in such aspects, like if it is fecal oral route, then we know that we should take food that is well cooked or things that are not contaminated. If it is through sneezing, we know that we should cover our mouth. While sneezing, we should employ the sneeze hygiene technique. Now, again, as much as there is a susceptible host and the port of exit and the means of transport, of course, there needs to be a port of entry. Before the infectious agent causes an infection, it has to enter the body of the susceptible host. So there is a port of entry. One of the areas is the oral route, through sexual route. It could be the respiratory route. So generally, or it could even be a break in the continuity of skin, which is the main area of concern in the dental unit. Then it is important to address the infection even at that point, at the port of entry. If I want to protect myself from an infectious agent that is a droplet or airborne, I can have on my mask. It is important to protect myself. So as much as the sick person or the reservoir may have a mask that protects from the port of exit, I might also have a mask that protects from the port of entry. So that is how infectious cycle goes. And at any point of the infectious cycle, which we also call the chain of infection, there are various techniques that can be used to reduce or kill the microorganism, or to protect or prevent from the infectious agent causing infection. Now, we have various objectives why infection control is important. One is to reduce the microorganisms. When the microorganisms are reduced, then the risk of infection is equally reduced. Now, how do we do that? And who does that? In the dental unit, it is the responsibility of the healthcare workers within the unit, the doctor, the nurse, the support staff, to maintain good hygiene and to protect the clients. So in that, the clients are equally given health education on how they can reduce the microorganisms, or they can reduce the chance of infection. Now, another objective is to protect. Whom are we protecting? We are protecting the healthcare providers, and we are protecting the client. If we have a client who has come in for tooth extraction, if we do not protect that client from infection, then they will have a nosocomial infection, which may complicate the healing process of the wound that they may have developed. And the most effective ways to prevent the transmission of diseases or infection, even in the dental unit, is hand hygiene, putting on protective gears, and sterilizing and disinfecting the instruments that are used. When we talk about hand hygiene, this is something that now is everybody is aware of, and the youngest of the children, because of the current status of the world. But generally, hand hygiene, approximately around 50% of the nosocomial infections could be reduced or could be taken care of if only everybody observed hand hygiene the way it should be. Observing hand hygiene does not only mean that you perform the hand hygiene, but you also perform it in the right way. You remember the moments of hand hygiene before performing any procedure. When you have touched the patient's vicinity, when you've come in contact with body fluids, blood or body fluids, you should remember all those instances of hand hygiene before and after performing a procedure. When you're moving in between two clients, you need to perform hand hygiene. Now, usually people go for shortcut. After removing the gloves, you just put on another glove and attend to another client. But it is important that after every removal of a glove, you do hand hygiene before you put on a new glove to move to the next client. Now, hand hygiene can be either hand washing or use of sanitizers, alcohol-based sanitizers. Now, hand washing is very important, especially when we have the visibly soiled hands. Though our use of sanitizers could be convenient because they can be carried at every point of care provision, and the alcohol content helps to kill the microorganisms that could be on the hands. It is also important to use the PPEs, the personal protective gears, like apron, like the face mask, like the face shield. All these, any person handling the patient should be advised or should put on the PPEs to protect themselves and more so to protect the client. Now, instruments that are used in the dental clinic during the procedures, the chairs, and any other equipment that is within the dental unit or the dental lab must be sterilized, and those that cannot undergo sterilization or the surfaces that may need to be disinfected must be disinfected in order to reduce the chances of microorganisms or chances of infection or chances of accumulation of microorganisms on the surfaces. Now, how do diseases get transmitted within the dental office? One, the infection can be transmitted from patient to the dental team or from the dental team to the patient. It can be from the patient to another patient. And when we talk about dental teams community, once a member of the dental team is infected, they can also carry the infection back to their families, and that would be quite a chain of infection. Now, it can also be a transmission from the community to the dental office, then to the patient. That is from the household of the dental team, or a member of the dental team, who in turn comes in, and as they attend to the patient, they transfer it to the patient. So the infection really is something that goes from one person to another, provided there's a chance. Now, we have standard precautions that cut across even into the dental department. Standard precautions that helps to minimize chances of infection. One is immunization, patient screening and washing, barrier techniques, of course, by use of PPEs, the needle and sharp instrument safety, and the policies about occupational exposures to bloods and body fluid should also be put into consideration. The instrument sterilization and disinfection, surface disinfection, radiographic asepsis, laboratory asepsis, infectious dental waste management, and disposal. Now, we're going to look at infection control during, before, and after dental treatment. The first one is before the dental treatment. What are the strategies that should be put in place? One is to remove unnecessary items from the dental procedure area. Once you are through with the dental procedure, it is important that all the equipments are well arranged or returned to their points. They are cleaned. So anything that is unnecessary around the area of the dental procedure should be removed, and anything that needs to be disinfected should be disinfected in order to prepare for the next procedure. So anything that is unnecessary should be removed from the vicinity. Then we have early preparation of the needed materials. When there is a plan to have a dental procedure, you should be able to identify that what kind of dental procedure is this that is going to be performed, which instruments are needed or materials are needed for this procedure. So you arrange before starting the procedure, such that during the procedure you will not be moving up and about and touching everything, causing contamination. Everything should be within the vicinity of the people who are working on the client, or should be in reach of the dental team as they perform the procedure. Now, another way of infection control before a procedure is to utilize disposable items whenever possible. If it is possible, the items that should be used should be disposable, such that there is no reuse. Now, use prearranged tray setups for routine or frequently performed procedures. Now, the prearranged tray setups, usually it is also easy to even autoclave the sets as they are. So whenever there's a procedure that needs to be done, you just have the tray that has everything that is needed for that procedure. It's just a matter of arranging it, just opening it up, and then you're free to go on with the procedure. Now, another thing is to identify those items that will become contaminated during treatment. During a procedure, of course, we have various instruments, various equipments that could be within the vicinity or within the room where the procedure is going to happen. All these materials, all these equipments are at a risk of getting contaminated. Things like the drawers, things like the overhead lamps, or things like the couches that could be around are at a higher risk of getting contaminated through touch during the procedure. So it is important that you identify such items and make sure that you know which ones can be protected by maybe covering or cushioning, or covering just with something a protective material, or which ones will be cleaned or disinfected after the procedure. You should be able to identify the equipments that will be disinfected and those that just need to be covered with protective gears. Now, it is important for you and the doctor to review the patient's records before initiating the treatment and place the radiographs on the view box. In this, you're trying to minimize the chances of touching the radiograph chart, touching the radiograph box, touching the patient records, which will in turn be touched with other people during the procedure. So it is important that you put these things up before the procedure, such that when the procedure starts, you don't need to go touching the patient's records and you only view the radiographs, which is already fixed on the view box. Now, every personnel that is involved in that patient care should be prepared. How are they prepared? They should put on the PPEs that are necessary for the procedure, the face masks, the face shield, every PPE, the apron, every PPE that could be used during that procedure that is necessary. Now we have infection control during the treatment. We have, apart from what we have mentioned, it is important that we also want to maintain or prevent infection during the procedure. So one thing is to use care when receiving, handling, and passing sharp instruments so that injuries are not caused by the sharp instruments. And it is important to use a rubber dam whenever possible. You should avoid touching unprotected switches, handles, and other equipment. And when you happen to touch these things, it is important to remember to disinfect them after the procedure. Avoid using gloves to open up the cabinets, because every time you use a glove to open up the cabinet, you contaminate it. Someone else will come and open it without the glove and they contaminate themselves. So try as much as possible to minimize cross-contamination during the procedure. Now, after the procedure, you should continue wearing your protective gear, but you may remove the gloves, of course, and put on the high utility gloves that will help in cleanup of instruments and the surrounding area. You will remove all the protective or disposable barriers that used to cover the equipment around to avoid cross contamination. If there are devices or equipment that needs to be disinfected, disinfect them appropriately. And after all this, the unit, the dental area that was used needs to be cleaned and disinfected in preparation for the next client. Now, in addition to what has been shared, it is important to do proper waste disposal in the dental unit. The standards are the same across all the health sectors, not only in the dental unit, even in the other areas, the waste disposal color codes are the same. And as you remember from your previous classes, we have black, we have yellow, and we have red, of which red goes for the very infectious waste, things like body parts or body tissues. The yellow is for waste that is not very infectious, and the black is for non-infectious waste, things like food stuff, things like shredded peppers. Yeah, so you should be able to remember to dispose of your waste in the right bin according to the color codes, and remember to dispose of your sharps in the right sharps container and handle them as they're supposed to be handled. Remember that at no point should you find yourself recapping a needle to minimize the chances of needle stick injuries. Now, for reference, we have these, which can help you in further studies or further readings. However, on the online platform, there are more materials that you can check on to help you get to understand the topic more.